Today, we're tackling a real medical mystery about chronic low back pain. Let's get into it.
So let's start with a puzzle that's really at the heart of all this new research. Okay, so this is an MRI of a key spinal muscle. See all those white areas?
That's fat moving into the muscle, kind of like the marbling you'd see in a steak. It makes the muscle weaker.
The muscle we're talking about is the lumbar multifidus. It's super important for your lower spine stability.
But now there's this new therapy to fix it. You can think of it like a pacemaker, but for your back.
A small device gets implanted. It sends these little pulses to a nerve, retraining that muscle to work properly again.
So the obvious question is, if you do this, does the muscle actually look better on an MRI, right?
Well, a brand new study just looked into that very question.
Okay, check this out. Left is before treatment, right is after. Honestly, do you see much of a difference?
So they compared the MRIs from 15 patients who got the therapy to 15 who didn't.
And the results? Kinda shocking. Both groups showed almost identical changes on their scans.
Yep, for the huge majority of patients in both groups, the muscles looked pretty much exactly the same.
In fact, get this, only a tiny 6% of the treated muscles showed any visible improvement at all.
So here's the big question. If the muscle doesn't look better, why do patients actually feel better?
Well, the real magic seems to be happening at a level that an MRI just can't see.
Turns out, the therapy seems to be healing these tiny sensors inside the muscle itself.
So it's not about building muscle mass. It's about fixing the communication line between the muscle and the brain.
It's like retuning a piano instead of replacing the strings. The function gets way better, even if it looks the same.
Okay, so what are the big takeaways from all this? Let's quickly break it down.
For scientists, the next step is finding new tools that can actually see these invisible, microscopic repairs happening.
It really makes you wonder, what if the most important healing in our bodies is the kind we can't even see?